With the researchers, I would say keep an open mind. Utilize your resources. I think I alluded to that in the meeting today, and saying you may have an Hispanic secretary or a receptionist. You may have a black janitor that comes through. These people you look at as your receptionist or your maintenance person or whatever. You need to look at them as resources because they are in their own communities, and they're in communities where they have churches, where they have whatever they may have. And maybe they can pass along clinical materials for you. And call the stakeholders. They're listed, phone numbers, cell numbers, everything's on there. With regard to people joining clinical trials, I think African Americans and Hispanics need to be clear. And again, this is a two-way street. You need to be clear about the fact that clinical trials is not Tuskegee. And I think most people who are under 40 don't really look at Tuskegee. The research that we've done with over 150,000 African Americans has told us is access and education. I don't know about the clinical. I didn't know it was a clinical trial. Where is the clinical trial? So no one is reaching across that bridge telling them that there are clinical trials going on. And I'm not talking about advertising on the radio, jazz radio station or the Hispanic ULA station. I'm not talking about that. I'm talking about going into those communities and talking with those people who are in those communities and taking it a step at a time. Maybe it's just a group of 8 people, but those 8 people, each one of them, is just think of interlooping circles. Each one of these individuals have their constituency. You have your constituency. There's probably 2-3 dozen people that you could get together, or that you know that if you knew something, whether it be the Dallas Cowboys or whatever, everybody in your constituency would know about it. Well, look at that the same way as clinical trials. If we get that message out and develop that trust among the people that they identify. Now, I have to say one other thing. And Evangeline Best brought up something. You're not getting to her community without going through her. And so when you're throwing out a jazz radio station or whatever, and you're saying, we've got paid clinical trials, millions of dollars are being spent on that. And there are a lot of people like us and people who actually can reach that community. I have had pharmaceuticals come to our company because we have another division called P&E Associates where we actually help companies recruit African Americans. They have had a trial going on for 2.5 years. They've gotten 4 African Americans. They come to us 6 months before the trial is out, and they want to pay us per person that comes, not per person that gets in the trial, but per person that goes through the trial in order to, but they don't want 4, they want 20 in the last 6 months. So I think clinicians need to really look at getting to us early. You need to get the resources of getting into clinical trials early, the people that know how to get you to those people. I think that's really the key.